My name is Goldey. It was really nice to meet some of you guys yesterday. Just really briefly, Ellina and I are going to go through a short presentation on how our residency is structured. You know, we're incredibly proud of where we train, and hopefully you guys over the course of today get a sense of what we have to offer and see if this is a fit for you. This is a quote from Dr. Rosenwasser that I think really encompasses the spirit of our training program. You know, he's really cultivated a culture of discovery that serves to advance the field of neuroscience. And ultimately, you know, we want to benefit society and create a healthier world that we're all a part of. And this is part of the shared responsibility that we have at Jefferson. You know, as you've heard from the other speakers today, you know, we really do get a lot of exposure to really the entire breadth of neurosurgery. And in addition to, like Dr. Sharon said, training master surgeons, we're really interested in developing the next generation of leaders in the field. And, you know, as Dr. Rosenwasser mentioned earlier, there was a Red Journal article a few years ago where, you know, they looked at the academic productivity of, you know, just the residency program itself. And they found that Jefferson was the most academically productive residency program in North America. In terms of how our residency is structured, I just want to point out a couple things. So we do chief year as a PGY6, and that opens up PGY7 to either pursue an enfolded fellowship, or for folks that want to, you know, do community practice, then an option is to do a transition to clinical practice year. Our intern year, you know, we no longer have a general surgery rotation. So the bulk of intern year you spend with us on the neurosurgery service, helping run the service, and that's really your responsibility. As Dr. Storm mentioned, as a PGY3, you'll spend 4 months at CHOP doing a dedicated pediatrics rotation. And then the PGY4 really is structured as a sort of a mini apprenticeship or mentorship year, where you spend 4 months with you know, 1 or 2 attendings and really get a chance to improve your surgical skills. You know, you get a lot more autonomy during this time. And then the PGY5 year is our dedicated research year that we have to pursue whatever clinical or research interest we have. We do use a night float schedule here at Jefferson as opposed to traditional 24-hour call. And this is an estimate of how much night float you can be expected to take throughout residency. The one thing I will say is that unlike a lot of other programs, all of your in-house call responsibility is done at the end of PGY4 year. Really the bulk of it is during PGY 1, 2, and 3, and then it really starts petering out as a PGY 4. We'll talk about this, I guess, during the course of the interviews, but we have, you know, several conferences, and residents don't attend every single one. You just attend the one that, you know, whatever service that you're on. The exception to that being Wednesday afternoon is protected academic time. And so the PGY5s host a board review session in the afternoon. And then Dr. Farrow will often come by and do a tumor case conference as well, which is a great learning experience. You know, Philadelphia is an amazing city. I think everything you've heard about it is true. It, you know, obviously has historical significance, but I think more than that, it's just a fun, vibrant, you know, very affordable city to be a part of. This is where our 2 main hospitals are. We have the Thomas Jefferson, you know, Gibbon building, which is the main hospital over here. But what's really unique about our program is that we have a dedicated neuroscience hospital called Jefferson Hospital for Neuroscience, or JHN. And this is the building where all the operating rooms, all the CAT scanners, the MRIs, the angio suites, you know, we're the only department that uses them. So we don't have to share resources with other departments. And just to kind of put this in context of where this is in Philadelphia, to your right here, this is where the Liberty Bell is, and this is where Independence Hall is. So we're about, you know, 3-4 blocks away from these historic monuments. Ellina?
All right, so Dr. Sharon has touched upon some of this already, so I'm going to try to be a little brief. But at Jefferson, we're very proud of, the fact that within each subdivision, we're trained by some of the leaders in neurosurgery. And so, our department is led by Dr. Rosenwasser, who's our chairman, is a pioneer in endovascular and vascular neurosurgery. He's really instilled this spirit and culture of innovation and patient-centered care that Dr. Jabor and Dr. Makaris, who are both his fellows and residents and are now part of the faculty, continue to propagate. Within each subdivision, we have some of the leaders of in spine surgery, where residents are fortunate enough to be exposed to anything from MIS to robotic surgery to deformity surgery. Our functional department, led by Dr. Sharon and Dr. Wu, is one of the best in the country as well. And residents are fortunate enough to be part of anything from stereotactic procedures to epilepsy surgery. Our tumor division is also phenomenal, and residents are able to participate in cases including endoscopic endonasal, open glioma cases to complex skull base. Next slide. We also benefit from the fact that our residents have diversity of backgrounds and have a diversity of interests. We have residents from Jefferson who went to Jefferson Medical School and recognized just how special our program is and chose to stay here. We have other residents from all across the United States, including Chicago, Indiana, Florida, California. And in addition to that, we have residents who are interested in basically every subspecialty within neurosurgery. And I think that the reason for that is really, our faculty and expose us to just every facet of neurosurgery, and we're able to start developing those interests. And the fact that those interests are diverse are just as a testament of just our well-rounded education at Jefferson. These are some recent graduates from only the past 3 years. We have graduates who've pursued academic positions as well as private practice positions. We have Mike Lang here, who did a vascular fellowship both at Jefferson and then went on to the Barrow to train under Dr. Lawton. He's now vascular faculty at Pittsburgh. We have residents, next slide, Goldie. Residents such as Christian and Rich, who just graduated last year and chose to stay within the neurosurgery family. They're both attendings at Washington Township in spine and vascular respectively. And again, as Dr. Sharon and Dr. Rosenwasser have mentioned, that's, as a result of them really loving the kind of environment we have and wanting to remain as part of that family and network. This is the case log for one of our graduating residents from last year. You can see that this resident exceeded and even in some cases tripled his case minimums. I would like to direct your attention to the open vascular subdivision, where he did 160 lead and senior surgeon cases in open vascular. This is historically a subdivision and kinds of cases that at other places can be hard to come by, but here he did 160 cases when the minimum was only 10. And again, this is a case log of a PGY4s for resident, and here you can see that many of the case minimums have been exceeded. This really shows that residents are able to get into the OR early and often, and we really try to emphasize just how tremendous our surgical education is here. In addition to our protected didactic time on Wednesdays, we also have the ability to practice our surgical skills in cadaver labs, which is a great addition to our program. You can see here that we partake in many spine labs as well as vascular and skull-based labs. We actually have 2 scheduled just next month in spine and skull-based. And so we're all looking forward to that. Something we want you to get, and I think some of you have already gotten a taste of this through our dinner yesterday, is that we truly enjoy spending time with each other. You know, beyond the work week hours, we look forward to gathering and being with each other. Here you can see that we're with Dr. Jabor, who graciously had invited us to his house, where we had a wine tasting event. He just happens to be a sommelier and was able to share his passion and knowledge for wine, which was great. But we really are a tight-knit family here at Jefferson. You know, something that why you should select Jefferson is because we have a high volume of clinical cases required to train proficient surgeons. We're just exposed to a wide variety of cases and facets in neurosurgery. Our clinical program is in the heart of Philadelphia, and we're a group of eager, enthusiastic, and self-reliant residents who are team-minded. You know, we're all very excited and thankful that you chose to join us today, and hope to be able to find applicants with like-minded ideals and attitudes when it comes to joining our Jefferson family.